Hello everyone. Today I am going to talk about fluoroquinolones. So let's start. These are the drugs which are present in this class. Ciprofloxacin, levofloxacin, Moxifloxacin, Ofloxacin, Norfloxacin, and nalidixic acid. Okay? These are the drugs which are present in this fluoroquinolones class. Now, coming towards the generations of the fluoroquinolones. So, these drugs are classified into generations based on their antimicrobial targets. So, the non-fluorinated quinolone nalidixic acid is considered to be first generation with a narrow spectrum of susceptible organisms. Okay, so nalidixic acid is considered to be first generation because this drug have very narrow spectrum, while ciprofloxacin and norfloxacin are second generation because of their activity against aerobic gram-negative and atypical bacteria. In addition, these fluoroquinolones also exhibit significant intracellular penetration, allowing therapy for infections in which a bacterium spends part or all of its life cycle inside a host cell, like in the case of the chlamydia bacteria, mycoplasma, and mycobacteria. So these two drugs have a significant intracellular penetration. Okay. Now, levofloxacin is classified as a third generation because of its increased activity against gram-positive bacteria. Moxifloxacin because of its activity against anaerobic and gram-positive organisms. Please remember this. Okay, so fluoroquinolones are commonly considered alternatives for patients with a documented severe beta-lactam allergy. Okay, so if there is a patient who is allergic to beta-lactam antibiotics like penicillins, cephalosporin, so these fluoroquinolones are alternatives. Okay, for that patient. Levofloxacin and moxifloxacin are sometimes referred as respiratory fluoroquinolones. Please remember this because they have excellent activity against Streptococcus pneumoniae, which is a common cause of community-acquired pneumonia. Okay, so these levofloxacin and moxifloxacin, these are called respiratory fluoroquinolones. Okay, and moxifloxacin also has activity against many anaerobes. Okay, so please remember this. Now coming towards the pharmacodynamics of the fluoroquinolones. So first generation and second generation of the fluoroquinolones, it inhibits the ligase unit of the topoisomerase 2 in gram-negative bacteria. Please remember this, okay? First generation and second generation. Okay, first generation means nalidixic acid, and the second generation ciprofloxacin and norfloxacin. These fluoroquinolones inhibits the ligase unit of the topoisomerase 2 in gram-negative bacteria, especially in E. coli, and nuclease unit are not inhibited by these drugs. Okay, so there is an enzyme which is called topoisomerase 2, and this topoisomerase 2 enzyme have two units. One is nuclease unit and the other is ligase unit. Okay, the nuclease unit is just like a scissor, while the ligase unit is just like a glue stick. Okay, so these first generation and second generation fluoroquinolones inhibits only the ligase unit, okay, the glue part of the topoisomerase 2 enzyme, okay, while the nuclease unit is not inhibited. So the cutting of the DNA strand is still going on, but rejoining of these segments not occur, okay, because these drugs only inhibit the ligase unit, not the nuclease unit. So the cutting of the strands is still going on, but rejoining of these segments not occur. So DNA converts into a lot of segments, and segmented DNA is not able to replicate and transcribe. Okay, and bacteria kills. So these first generation and second generation drugs are more effective against gram-negative bacteria. Okay, so these first generation and second generation, it inhibit the ligase unit of the topoisomerase 2 enzyme, okay, and not the nuclease unit. So this ligase unit is just like a glue stick, okay, and the nuclease unit is just like a scissor. So the cutting process is still going on, okay, but rejoining of these segments not occur. So DNA converts into a lot of segments, and we know that segmented DNA is not able to replicate. So bacteria kills. So this is the mechanism of action of the first generation and second generation, okay. Now, coming towards topoisomerase 4. So, this topoisomerase 4 enzyme is mostly present in gram-positive bacteria. Okay, so third generation and fourth generation, fluoroquinolones blocks the ligase unit of the topoisomerase 4. Okay, and it have and this enzyme have two nuclease unit and one ligase unit. Okay, please remember this, that topoisomerase 4 enzyme have two nuclease unit and one ligase unit. It means that it have two scissors, okay, and one glue part. So this enzyme prevents the tingling of the DNA and separates the two strands, but in the presence of these drugs, a lot of small segments of DNA is present. So third generation and fourth generation are effective against both gram-positive bacteria and gram-negative bacteria because it blocks both the enzymes topoisomerase 2 and topoisomerase 4. So please remember this point. This is very important, that the third generation and fourth generation drugs, it blocks both the topoisomerase 2 and 4. So that's why we can say that these drugs are more effective in both the cases against gram positive and against gram negative. Now coming towards the pharmacokinetics of fluoroquinolones. So these drugs distribute well into all tissues and body fluids, which is one of their major clinical advantage, and the levels are high in bone, urine, but except moxifloxacin. So that's why we can say that moxifloxacin is not used for UTI, urinary tract infections, okay? Penetration into the cerebrospinal fluid is relatively low except for Ofloxacin, okay? Ofloxacin also reaches to the brain, okay? This drug is able to cross the BBB, blood-brain barrier, okay? All fluoroquinolones are excreted renally except moxifloxacin, which is excreted primarily by the liver. Please remember this point, okay? That all fluoroquinolones are excreted renally, but moxifloxacin is excreted primarily by the liver. Now, coming towards the drug interactions of the fluoroquinolones. So, sucralfate plus antacids, iron, zinc, calcium, and other divalent cations. So, it decreases the absorption of the fluoroquinolones. Please remember this, okay? That sucralfate, antacids, iron, zinc, calcium, and other divalent cations will decreases the absorption of the fluoroquinolones. And quinolones, it increases serum level of the warfarin, caffeine, cyclosporine, okay? And ciprofloxacin, it increases the serum level of the tubulin, okay? So please remember these drug interactions. Now coming towards the adverse effects of the fluoroquinolones. So these drugs causes nausea, crystalluria, leukopenia, QT prolongation, headache, dizziness, vomiting, tendinitis, arthropathy, photosensitivity, diarrhea, increased liver enzymes. Okay, so these are the adverse effects of the fluoroquinolones. But please remember that these drugs causes arthropathy, tendinitis, crystalluria, QT prolongation, photosensitivity. These are the very famous adverse effects of the fluoroquinolones. Now coming towards the clinical uses of the norfloxacin. So this drug is very effective in UTI, urinary tract infection, prostatitis, okay, and uncomplicated gonococcal infections. The uses of the ciprofloxacin. So ciprofloxacin is effective in lower respiratory tract infections, LRTI. Okay, and this drug is also effective in UTI, urinary tract infection, sinusitis, okay, bone skin infections, and this drug is the drug of choice in anthrax, and this drug is also effective in typhoid fever and urethral infections, infectious diarrhea, cervical gonococcal infections. And please remember this, that ciprofloxacin is effective in cystic fibrosis in children, and this drug is life-saving drug in this condition in children. Okay, so please remember this point. Uses of ofloxacin. So ofloxacin is effective in urethritis, prostatitis, lower respiratory tract infections, skin infections, urinary tract infections, uncomplicated gonococcal infections, chlamydial cervicitis. Okay, so this drug is effective in these conditions: chlamydial cervicitis, okay, and uncomplicated gonococcal infections, UTI, skin infections. But this drug is very effective in skin infections, okay, urethritis, prostatitis. Now, coming towards the uses of the levofloxacin. So this drug is effective in UTI, severe skin infections. Okay, this drug is very effective in skin infections and resistant TB. Okay, please remember this. And this drug is also effective in pneumonia. As I already told you that levofloxacin and moxifloxacin are respiratory fluoroquinolones because these drugs are able to kill a bacteria which is called Streptococcus pneumoniae, and that bacteria causes pneumonia. So these two drugs are effective in pneumonia, okay, and LRTI, lower respiratory tract infections. So these are the uses of the levofloxacin. Now coming towards the uses of the moxifloxacin. So moxifloxacin is really effective in chest infections and complicated intra-abdominal infections. Okay, and this drug is effective in pneumonia. So now coming towards the doses. Okay, so the dose of the ciprofloxacin is 200 to 600 milligram every 12 hours. Okay, and the elimination route of this drug is renal. Okay, and the half-life of this drug is 5 to 6 hours, and it is given when given IV. Okay, and gemifloxacin, the route is fecal. Okay, and the half-life of this drug is 4 to 12 hours. Okay, and the route is oral. Similarly, the dose of this drug is 320 milligram once daily. The dose of levofloxacin is 250 to 500 milligram every 24 hours. Okay, and moxifloxacin, the elimination route is hepatic, please remember this, okay? And the half-life is 12 hours. And the dose is 400 milligram once daily. Similarly, ofloxacin, the dose is 100 milligram per day to 400 milligram per day. And the elimination route is renal, okay? The half-life of this drug is 5.0 to 7.5 hours, and it is given orally. Now, use in pregnancy. So these drugs causes articular cartilage erosion, arthropathy. So these agents should be avoided in pregnancy and lactation and in children under 18 years of age. Okay. So the fluoroquinolones, these drugs should be avoided also in children under 18 years of age. Please remember this. But there is only one condition, which is called cystic fibrosis, okay, in which we gave the ciprofloxacin, and ciprofloxacin is the life-saving drug in that condition, okay. But except this condition, these drugs should be avoided in children under 18 years of age, okay. So this was all about fluoroquinolones. If you have any question, you can write in the comment section and I will answer. Thank you so much.